Recognizing the member for Langley East.
Thank you, Honourable Speaker. Absolutely, every British Columbian, no matter where they live and whatever their health concerns, should have access to the care they need when they need it. So I'd like to thank Member Opposite for bringing this forward. The pandemic has shone an even brighter light on the importance of health services, and in Budget 2021, our government continued to protect people's health and safety with $4 billion in new investments over 3 years, including launching our primary health care strategy, which focuses on faster team-based care, hiring more than 660 new full-time equivalent health professionals who will be part of 22 primary care networks throughout the province. In establishing primary care networks across 65% of BC's communities since that strategy was started. Government has invested over $1 billion over 3 years to improve care for seniors, which includes investments in primary care, home health, long-term care, and assisted living. We've opened urgent primary care centres, and these centres provide primary care to patients who do not currently have a family doctor or nurse practitioner, and weekend and after-hours care, taking pressure off hospital emergency departments. A total of 16 of these urgent primary care centres are now up and running across the province. We've included community health centres, and these health centres bring together health and broader social services to improve access to health promotion, preventative care, and ongoing services. We've dramatically boosted the number of MRI exams and elective surgeries as part of the surgical and diagnostic imaging strategy, and increased the number of priority surgeries and diagnostic imaging like PET scans and CTs to ensure faster access. Increasing staffing levels in long-term care homes, taking action, lowering drug costs by making record investments in fair pharmacare, and moving forward with a first-of-its-kind children's complex care transition facility in BC to fill in those gaps in much-needed services. So, Honourable Speaker, as I said earlier, every person deserves to have the best possible health care close to home. And one of the things that our government is focused on is boosting support and hiring to enhance services in Northern Health. So people living in Northern BC are benefiting from additional government action to deliver needed healthcare services, and the government announced $6.38 million for programs to retain and recruit more healthcare workers, and by making the Northern area a desirable and accessible place for health professionals to live and work. Our government's been working with Northern Health regarding concerns on recruitment and retention of healthcare workers in the North, and to address these, actions are being taken at every level in Northern Health, starting immediately with the launch of a comprehensive healthcare worker rural retention program. And the program is designed to offer financial incentives and support for healthcare workers, and is funded by the Ministry of Health at approximately $3 million. Funding of $821,000 to continue the travel resource program, keeping more than 40 registered nurses and licensed practical nurses in the area. $225,000 in funding to develop a childcare program to support expanded new net childcare spots and expanded hours of operation to meet the needs of healthcare workers who often work 12-hour shifts. $750,000 to develop a housing program in communities where suitable market housing is a barrier to permanent staffing, and $825,000 to launch the Rural Doctor in Aid virtual support pathway. These new programs will help retain and recruit more healthcare workers to provide needed services. And our government knew that the way to fix healthcare was delivered. The way that healthcare is delivered had to change. And we're working to fix those problems and ensure that those left behind are now brought into the net and transforming the way it's delivered. So not just for people in the community, but for everyone around the province through these strategies. My colleagues and I know that there's more to do, and we're committed to delivering the health care services that families in BC count on. And I'm very excited to have been able to stand here today, Honourable Speaker, and talk about the investments and the pathway forward that will ensure that every British Columbian has access to the health care needed in a system that unfortunately had previously been systemically underfunded, and our government's worked so hard over the last several years to reinvest to ensure that there's equitable access throughout the province. Thank you, Honourable Speaker.